Hi, good evening. Welcome to another episode of Let's Talk About Mental Health, a program about mental health and addictions. My name is Nels Kloster. I'm an addiction psychiatrist working in southern Vermont.
My name is Robert Stack. I'm a licensed drug and alcohol counselor and a licensed mental health counselor. Good evening.
And tonight, for the first time, we have a guest on our program, Mary Ellen Copeland.
Glad to be here.
Nice to have you. And we invited Mary Ellen tonight because it was part of a group of 30 people back in the, was it the 60s?
1997.
1997, who developed a program called WRAP, which is Wellness, Recovery, and Action Program, which has very much to do with patients or clients, if you will, having an active role in their treatment. And since that's what we've talked about, quite a few episodes before, we thought you made the perfect first guest for us.
Good. Glad to be here. This is good.
Yeah. So we'd love to have you start off by telling us a little bit about the WRAP program.
Well, before I was traveling around, first started in New Hampshire and then Vermont, teaching people recovery skills and strategies that I learned through a big research project that I did in the late 80s and early 90s. And that research project was actually the subject of my first book, which was the Depression Workbook. And it was about how people recover actually from all kinds of mental health issues. The publisher said I had to call it the Depression Workbook or nobody would buy it. But it was really about all kinds of mental health issues. And I was teaching all of that, and I taught it in New Hampshire, and then Vermont jumped on and said, we want you to teach it in Vermont. So I was teaching in northern Vermont, January 1997, and we had a group of 30 people. That was 30 or 40. That was about our limit. We didn't want the groups to be too big. And it was a lot of people who experience all kinds of mental health issues, challenges. There were people there who were having a very difficult time. There was a person there who had to have an attendant with him. He couldn't really look you in the eye. He couldn't talk. And he came every time with his attendant. He had to leave often and come back in the room. There were people who were having trouble. They had to pace. They were anxious. They were agitated. And yet we did these workshops for 8 days, and people stayed with it, and it was really amazing. But it was at the end of that when a woman, Jessie Parker, who's kind of well known here in Vermont, stood up and said, I've been in state hospitals all across the country, and I wouldn't have any idea how to organize these things into my life. And that's when the group took on that challenge, and we got the state of Vermont to support us for another 3 days of work together. And with Jane Winterling, and who many of you probably know because she lives in Brattleboro, we worked together with that group, and they came up with the Wellness Recovery Action Plan. And they said, we need this, we need a wellness toolbox, we need a list of what we need to do every single day to stay as well as we can. We need to notice when things happen that are upsetting to us, and then we need to figure out which of those wellness tools we need to use to get back so that we're feeling good if something upsets us. We need to know what our early warning signs are, and then which of those wellness tools do we use if we start having early warning signs. That's the action plans piece. And then they said that another piece has to be, suppose things get really bad. And people talked about that place, and they said, this is a place where we usually call emergency services. Maybe we get admitted to the hospital. Maybe we ask to have our medications changed. And they said, but maybe if we use those wellness tools, we can bring ourselves back by ourselves. And so they came up with that. What are the signs that we're having a really rough time, and what can we do to bring ourselves back? And people started using that, and it was working. They were really these simple, safe, non-invasive things that were part of their lives, used at the right moments, were bringing them back. They also added to that a crisis plan and later a post-crisis plan. But those pieces, that list of resources, and then daily maintenance plan, triggers, early warning signs when things are breaking down, it just really resonated with people. And when they do that, they feel they don't have to use the crisis plan. Because they can take themselves back.
Right. So it's like an ounce of prevention is worth a pound of cure.
Oh, absolutely, absolutely. And when we did that, I was really excited about it. And I've had mental health issues kind of all my life. My mother, when I was a kid, spent 8 years in the state hospital in Connecticut. And when I got older, I think I started responding the same way she did, by having these deep depressions and kind of out of control manias. And I was trying to get on top of those, and I'd had some success, and I was working doing the things I wanted to do. But when they figured out RAP, and then I took it home and did one for myself, and I started using it. I said, whoa, this was a big leap in my own wellness.
Yeah.
And my life has really changed because of that, really, my own personal life.
And I'm thinking, not to be embarrassing, but this has become sort of an industry.
It absolutely.
There are.
We have. I'm trying to retire. But we have thousands of people now who have been trained to teach this, and it's being taught all around the world. One of our major trainers is just back from Japan. I've been to Japan several times, New Zealand, Hong Kong, Netherlands, England a lot, Ireland, everywhere. It's really in a lot. There's no place, no state that it doesn't have a good RAP program.
Yeah, why do you think this has resonated so strongly with people in the mental health community?
It seems to work. It works. It works, and we've worked hard. There have been a lot of people that have helped to spread it, to teach about it. People really like it, and so it goes from person to person to person. There's a group going right now here over at Brattleboro Memorial Hospital, people getting together. I'm not sure, I think it's Wednesday afternoons, and they're working together to develop their RAP plans. People like to do it in a group. They like to, because they get ideas from each other. And that seems to work really well, and they become friends. Some people who've never had supporters become friends in these RAP groups. And they enjoy that, and then sometimes once they've gone through the whole process, then they have a RAP support group that they can go to help them if they want to do that. It's all voluntary. It's all self-developed. Nobody tells you what you have to put, what you don't.
Not authoritarian
There's
at
no
all.
authoritarian. It's all totally voluntary, and there's no, you don't have to be ready. You're ready when you want to do it. And we've had kids do it, and we've had people who have real developmental difficulties, and to be able to adapt it to whatever a person's needs are. It's been really.
One of the things I liked in the hospital, and I used to give the handbook out to patients after I talked to them a little bit, and one of the things that I used to do in teaching addictions, we would talk about the importance of acceptance.
Yes.
We talked about this earlier.
Yes.
And for me, acceptance is more than just acknowledgement. It's really taking responsibility.
Yeah.
And one of the things I really like about using the RAP plan and handing it to patients is to sort of say, here's a plan.
Yeah.
Here's some ideas. This is your illness.
Yeah.
Not only can you take responsibility for it, but you can also establish some modium of respect almost.
Right.
That, I take care of myself. I have a plan. I know how to do it. And a lot of times when we talk about the mentally ill or addictions, it often sounds like treatment is something that happens to them.
Right.
Like when you hear, and we said earlier, somebody says, they put me on these meds.
Yeah.
You know what I mean? Rather than saying, like, here's what I need. Here's what I need to have a good quality life, and here's the way I'm going to live. And it's ultimately, I think, that when I say the word responsibility, it's just sort of that I can take care of myself.
Right.
I can make decisions about my care. And I think the one thing that we were talking about earlier was, sometimes I can even make decisions and let you know what I want you to do.
Right, exactly.
If I end up in trouble.
Exactly.
And I've always liked that part of that.
That's part of the crisis plan.
Yeah.
Is that the crisis plan is where people identify when they want other people to step in.
So like advanced directives for mental health.
It's the same, crisis plan, advanced directive, yeah. And there's a whole section which I think is kind of unique to the RAP advanced directive, is that people say, when I'm like this, or this, that's when you need to step in. Lots of times people were stepping in back when people could really figure out ways to help themselves. But so the people could write, when I'm throwing furniture around, when I'm threatening to hurt somebody, when I'm, cutting myself, when I'm drinking so much that I'm just flat out drunk for days. What are the real signs that somebody needs to step in? And people identify that for themselves. And then they say, these are the people who I want to step in, because in my case, there's some, you run into people that you resonate with for doctors and helpers, and some that you don't. So you make a list. These are the people. And I have family members that are great, some that I want to help me out when I'm having a hard time, and some, no way.
That don't belong there.
Yeah, that don't belong there. And then clear lists of what are the treatments, and what can you do that would help? What can you, as my supporter, do that would help? And what should you avoid doing? Because lots of times people do things that are not helpful, in fact, make things
Makes
worse.
things worse, yeah.
And they mean to be helpful. They really mean to be helpful. So it's a different kind of advanced directive, and yet it's widely accepted at this point.
Yeah, and we talked earlier about sort of like a richer toolbox, but one of the sort of dissatisfactions around maybe psychiatry and medicine is that there's this strong link between a problem and a medication. If I have this, then prescribe this for me.
Right.
So I'm curious if there's been tension with the medical community around RAP.
Yeah, well, it hasn't. We were warned that there would be a lot of tension. The tension hasn't really developed, and actually, I should mention that that RAP is now as we've gone through all of the research processes, and it's now listed on the National Registry of Evidence-Based Programs and Practices, so that it's very widely accepted now, and lots of doctors are really appreciating that if you give somebody a RAP and people start to work on it and get better, that it's really gratifying to them. Whereas if you just hand somebody a medication and don't do anything else, they might not see any change. And what I'm wishing is that lots of doctors would say first, okay, what are all the things that you can do to help yourself? And let's work with that. And then when we see what we can't cover, then maybe we need to work for medication instead of the other way around.
Yeah.
That we as people have rich resources that we can use that we don't really think about. But if I'm starting to feel low, I have several beautiful granddaughters who are just little, and if I spend the afternoon with one of those kids, I'm happy again. I have some grandsons that are bigger, and I love it when they come over and they set up these things around the yard, and they're riding their bikes and stuff around the yard.
Yeah.
You know, they're having a wonderful time. And that helps me. Going for a walk with my dog, working in my garden, having a good talk with a friend. One of the things that I found that's a Brattleboro thing that specific to Brattleboro that really helps me is 4 days a week I go to the senior center, and there's an exercise class at 9:30, and a group of us get together. It's a little different group every time. We have the best time. We talk and we laugh, and it's part of my social circle, and we talk about all kinds of things. And so we have all of these things. There's many things that go on at the senior center, many things that go on at the library. In Brattleboro, there's always concerts. There's so many things that go on that all help you to feel better. So we all have these things. I like to work on quilts, and that helps me feel better. I like to play the piano a little bit, and that helps me feel better. So instead of we overlook all of that, and I overlooked all of that in my own life. I tried to do those things, but I didn't realize the value until I started working with RAP. And my spouse and I were doing a training in Oklahoma, and it was right about the time of the huge tornado came through Oklahoma City. We went there for 2 weeks, a week, and worked with people, and then we went back, and in between the big tornado went through. And so we spent a lot of time talking with people about their wellness tools. What were their wellness tools? They came up with hundreds. People can come up with, think about hundreds of wellness tools, and when they come up with that list, then other people can look at it and say, oh, that one will work for me, and that one. Maybe not all of them, but a lot of them will work, and it's really amazing.
Do you think a version of RAP can also work for family members? I mean, sometimes you'll feel, I have contact with family members who feel overwhelmed by a loved one's illness, and they don't seem to be willing or whatever, they're not ready.
Yeah.
What can family members do to be?
Well, I just wrote a book called Family RAP that is very popular, but I really encourage family members to develop a RAP of their own personal RAP, so that they understand what they have to do every day for themselves, what upsets them, what are their early warning signs, so that they're working with that. And it helps them to feel better. The other thing it provides modeling for the person who's having the difficulties, and they'll say, whoa, now if my mother's doing that or my sister's doing that, and look what it's doing for them, then this is something I should.
Yeah, because we're often talking about nature versus nurture, genetics and environment, and an addiction doctor a long time ago when I was a medical student. I'd asked about, drinking in the family. If your parents start you early, is that a problem? And what he said was that what really matters is the drinking behaviors that your parents model for you.
Right.
So if you see them getting drunk and falling down, then you're more prone to do that as well. Whereas you see, a glass at holidays, you're more likely to do that yourself.
Right.
And so I like that idea that
the rap is another way. It's a model. It's that family members can all use, and they could develop. In the book, we developed a prototype that the whole family can have a rap. So, like, what are all of the resources the family has that they can use? What are all the wellness tools? Like having dinner together, having at least one meal a day together, going for a walk together, working together on projects around the house. There's many, many things that families can do together, and then putting that in the same format as an individual rap.
Sometimes in addiction, when we used to talk about family members going to Al-Anon or something, but they would see warning signs of pending relapse.
Yes.
And I used to say to patients, give your family permission to tell you when they're worried about you. Because a lot of times you hear a family member say, "Oh, I could see it coming."
Yeah, but why didn't you tell me?
But they didn't have a forum to talk about it. Like it wasn't already agreed that when you see this or when you feel it, I want you to tell me.
But if you have a family rap, you can have that. That can be okay. Tell me if this and this and this are happening, or even a personal rap. The part of the beginning of rap is for yourself personally, but that advanced directive or crisis plan goes to all of your supporters, and so in there it can say, tell me if this has happened. Yeah, it gives directions. It's really, that's what that document should be. It should be directions for your supporters.
Okay, yeah. And I was impressed by how sort of, say simple or distinct the various pieces of a rap plan could possibly be. You can easily recognize and pull these off, but also that there was sort of daily component to it, that it really is not something you put together, put on a shelf, and dust off every month or so.
No, you have
There's a daily...
There's a daily thing, and to make it easy for people, we've sort of, over time, the most recent thing is a rap app, so people can have it on their phones. They can develop their rap plan on their phones, but there's an online thing that people can do. We have in a lot of different books, but to try and make it as accessible as we can for people, and then so people can either do it in a notebook, they can do it on a binder, but now they can do it technologically. Several different ways they can do it on their computer.
And it's a nice focus on wellness.
Yeah.
It's not a disease focus, it's a wellness focus.
No.
And the other thing that I like is that it mentions action.
Yes.
So you can think about something and not do any and change, but you take action and it changes your thinking. Here's things that you can do. Yeah. And I've always liked that about it. It was concrete.
Yeah, they're not hard. There's not you can find something really simple to do.
We've noticed that when people come into treatment with us and we work together, that when they're still blaming everybody else.
Yes.
I'm quite not ready to change, rather passive about it. Please, fix me, help me, give me medication.
If only you would do such and such, I'd be better.
Yeah.
But it doesn't work that way.
No, so I'm curious, how do people, would you see it's like a process that people go through before they are ready to engage in rap?
Yeah, when I first started doing this work, I came up with these key concepts that seem to appear all through all of the research that I did. And the first one was hope, that people have to have a sense of hope. But then the second one was personal responsibility, and that it's up to the individual to develop that for themselves. And people can slog through their life and never take that personal responsibility and say, if only my mother hadn't done that, or if my sister hadn't done that, or if this happened, or that happened, or if somebody else had done something differently, and they never get any better. And then those people that say, I've gone to this support group, I've identifying my wellness tools, I'm fixed my diet, I'm avoiding sugar, I'm not drinking anymore. Those are the people that take responsibility that really get better. So there were 5 of those that I identified: hope, personal responsibility, education, self-advocacy, and support. Those were the 5 key concepts that we talk a lot about in the RAP training.
And I think out of that sometimes will come pride.
Yeah.
The pride of taking care of yourself, increased self-esteem. I think a lot of times when people, both addiction and mental illness, they sort of don't like who they are. They begin to feel like I'm not good enough, all that stuff. And I think when you take responsibility for whether it's going to meetings and therapy, taking your meds, you get a sense like I'm taking care of myself. And it's not somebody else's credit that I'm getting better. It's to my credit that it's getting better. I mentioned earlier to you something I was hoping you could say more about it. one of the things that we struggle with, and you talked about it last week, is relapse.
Yes.
And how traditionally people tend to look at it as a treatment failure.
Yeah.
And would you give another point of view on that?
Yeah, another point of view is it's a learning. It's a learning, and so if you're using RAP and say you got to the point where things are breaking down, or even in a crisis, that's an opportunity to learn and to revise then your RAP so that it works better for you for another time. So it's really a learning opportunity, and it's too bad when people are shamed or blamed for that, because it's not really like that. People should not be shamed and not blamed, and that only makes things worse. Mm-hmm. So if people can be say, look how well you came through this time, and you've got more and more wellness tools we've identified, and we can change this and we can make it so it works better for you next time, and it's been all this time since this has happened. That's great. Mm-hmm. You haven't had to be hospitalized in this many months, and before that it was every month. To point out those great successes instead of, it's really a strengths-based approach, that we look for people's strengths, that these are what you're doing well, and build on that rather than the opposite a lot of the time, which has been look at all the deficits.
Right, yeah, and I think to kind of steal from AA, that we're looking at progress in the way you describe that, and there shouldn't be the expectation of perfection.
No, there's no
for any of us.
Yeah, and that's what we always talk about in the RAP books, that this is yours to revise, to change. You can cross this out. If working within that structure seems to be really helpful, and then just to revise it. So my RAP plan at this point looks a whole lot different than it did back in 1997, because I've added lots of stuff. I've new family members, live in a different place. All those life changes. I've developed new interests. I've found that some things work. There's some things that I've left behind. So it's changed, and it works better and better for me over time.
Thank you. I don't mean to set you up in any way or put you on the spot, but I mentioned earlier when we talked about this that recently there's been some talks about involuntary hospitalizations and medications, and because of all the publicity about mental illness and violence and whatnot, and so I think the legislature is going to be taking a look at that this year, and I was wondering if you, from your wisdom, if you have some comments you would like to make. Not specific, but just in general.
What I really feel strongly about is that people should be totally encouraged to take personal responsibility and taught recovery skills and strategies so they never get in that position, so that they never get in a position where there are decisions being made about involuntary medication and involuntary treatment. It's really up to the individual too. I think personal responsibility is a huge part of that, and you can, if you start way back, when you first start feeling crummy, and that's when you start doing what you need to do to take care of yourself, hopefully you'll never get to that awful place, because I don't think anybody really wants to involuntarily commit somebody or involuntarily treat people. Several years ago, I did a study of people who were repeatedly involuntarily committed, and to say, what would help you to break this cycle? And what they said was, we want recovery skills, we want strategies, we want to have access to RAP, we want people to work with us on RAP. That's what would help. So getting into the debate over it is hard for me, because it's so misunderstood and so difficult. And I just would like to see us working toward wellness with people.
Yeah. And Mary, as we're talking about this, we're talking about what role the patients or clients should take in their care. But I know kind of through my training, and particularly a doctor I work with, Stuart Graves up at Washington County Mental Health, really taught me to be more of a sort of maybe a consultant or a partner in the treatment. So I'm wondering if you might comment on maybe what therapists and physicians could stand to learn to help RAP be effective for people.
Well, I think that they need to know it, and I did a program for a while called RAP First, that all kinds of people who are providing care and support would first begin to look at what are the resources that you have yourself.
We're trying to increase the distribution of this program. We have people watching it not only in Brattleboro and other areas, and I was wondering if you could take a minute or two and just tell them a little bit about how to contact you and how to find out more.
Yeah, you can contact me at info at mentalhealthrecovery.com or info at rapandrecoverybooks.com. So there's various ways you can go on to the web and just go to Mary Ellen Copeland, and you'll come to our website. And just send me an email if you want to get more involved in this. And we'll get back to you if you want to find a rap group, if you just want to know how to get started. Our website is really intense, and you can really work through that. We have a whole training arm, so it depends on where people are. Somebody might say, I really want to be teaching this, and so I can send them in that direction. We have a Copeland Center that does that, and we do the books. But there's lots of information, and there's groups going on right now in Brattleboro that people could learn how to do rap. So let us know. info@rapandrecoverybooks.com, info@mentalhealthrecovery.com.
Thank you very much.
Yeah.
It's been great having you and having you share this with us. And,
Really nice being here.
Absolutely.
Nice.
It's at times just kind of flown
sort of
by,
went
right?
by, and I wanted to make sure that we took some time to talk a little bit about the future programs coming up. And next week is going to be a really difficult one. We decided to talk about spirituality.
Great.
Which it's the kind of thing that, everybody thinks is a good idea, but it's not something we talk about too much. I guess it's like last year's personality disorders.
Right.
We
didn't want to touch that.
We didn't want to touch it.
And the two people do see differently, sort of the spirituality or religiosity, which can be two sort of separate sides of a coin, maybe.
Yeah, people, when somebody's, thinking that there's some great spiritual leader or something, everybody says, oh, you're in real trouble. But on the other hand, sometimes that spirituality can be really helpful to people.
Great piece. And again, you hear about this 1%, you know what I mean?
Yes.
You hear about this, they're talking to God or something,
Right,
but
right.
to have a connection, to have a spiritual life is so important. I mean, you mentioned hope.
Yes.
Belief, hope, love, all those things are so important. So anyway, that's what we're going to tackle next week.
We're going to try it. Because I think even folks I've talked to said that they're atheists or agnostics or no sort of spirituality or religiosity. They'll at least agree they're not the center of the universe. And so sort of leave that open for a larger sort of community or a sense of connection to something larger themselves, which I think, as we've been talking about, is essential for our mental health.
Right.
So in our closing minute, if you have one last statement that you would like to make and for the folks who are listening.
Yeah, I would really just like to say that if you're having a rough time, look at what are the simple, safe, non-invasive things you can do to help yourself right off. And you can be in touch with us, and there's lots of ideas on our website, and it's all free, and you can just take it and move forward. Get yourself feeling better quickly.
Thank you. Thank you again.
Yeah, no, really important to have sort of a richer toolbox.
With
Just
toolbox,
medication, not against medications, not necessarily for them, but really for sort of getting to know the person, to get in touch with what would make a good rap plan for them, what would help them to be healthy, and that really to take a larger picture of people and to work in that fashion, I think, is much more satisfaction and much more productive.
Yeah. That's great.
It also, and I was at a luncheon today where people were talking about trying to make sure we can get proper medications and people getting into therapy that they need. But the other thing I think that RAP does is it involves family.
Yes.
It involves friends, colleagues.
Yes.
And so it's not just pigeonholed between this person at 4 o'clock on Wednesday, and that's it, and then you go get your meds here, and that's it.
Yeah.
It's much more.
It's your life.
It's your life,
it's your life.
And the people around you too.
Yeah.
If you do this right, you're not in isolation, and I've always thought that was a nice piece of it.
Yeah, thanks.
Because community makes a world of difference.
Yes.
It's horrible to feel that you're out there all alone. And I think sometimes that's how you feel.
Yeah.
Because of the way your mind is thinking or whatever. You have that sense that I'm lost.
So again, we're social animals, so we need other people.
We need other people.
So, once again, I think that's the end of another episode. I want to really thank folks for tuning in. And again, send us your questions. We have a website and an email link. And as Mary Ellen has said, if you're interested in more about her program, we can find that at our site as well.
And you have proven that we need guests like you. Thank you so much. Our show is much better. Thank you.